So today's topic is food sensitivity. It's on page number 464. 464. Food sensitivity. Yeah. So food sensitivity. There is a different spectrum of food sensitivity. We'll see that later. Okay, like food intolerance, sensitivity, food allergy, etc. Okay, so food sensitivity means when the body's immune system, your immunity, which should normally fight infections, but now what is happening here is it considers certain components of food as an invader. It considers food components as infections, and it will start having inflammatory reaction just by having certain food components. Okay, these components by nature will not cause any harm to the person. Okay, in its original form it is not supposed to cause any harm to the person ingesting these components, but depending on an individual's immune response, these components may lead to food sensitivity. Okay. So food sensitivity and food allergy is kind of the same thing, but also different in certain ways. Okay, like in food sensitivity, you have immediate response and delayed response. The sensitivity reaction which has an immediate response, as soon as you have that food, immediately within 2 hours or less you get a reaction, that is called food allergy. Okay, and the other kind of reaction which is delayed. Okay, there is no immediate reaction to the food. It may take up to 72 hours, 3 days or 4 days to show up the reaction. Okay, so that is called food sensitivity. Okay, immediate response and delayed response. So food allergy is usually developed in infancy. In infants, okay, only 2% of adults will develop new food allergies. Otherwise, since infancy and childhood, you have certain food allergy. And food sensitivity, it can happen at any age. 45% of the population suffer from food sensitivity, and it doesn't have a specific age group to start with. Okay, and reaction immediately, you will have a reaction 2 hours or less, and sometimes in food sensitivity there is a delayed reaction to a food up to 72 hours. Post 72 hours you may feel bloating, indigestion, etc. So food sensitivity is not deadly. You may be having n number of symptoms due to food sensitivity, but these in turn will not harm. It is not life threatening. Okay, so bloating, joint pain, irritable bowel syndrome. IBS means irritable bowel syndrome, tiredness, eczema, low mood, headache, weight gain, etc. In case of food allergy, the reaction is immediate and it can be life threatening if a person goes into an anaphylactic shock. Anaphylactic shock means a severe allergic reaction. Severe allergic reaction in which your windpipe, your trachea, it closes up. Okay, leading to oxygen deprivation for your main organs. It may turn into life threatening if antihistamines are not given on time. Okay. So the most common food sensitivities are from wheat, gluten, dairy, milk products, corn, eggs, sugar. Gluten is anything like it's a flour. When you are adding water to it, it becomes sticky. It sticks to each other. Okay, it means it has gluten. The flour, millet flour, etc. Those are not that sticky when you add water into it. So that is gluten free. Okay. Most common types of allergies are peanuts, tree nuts, eggs, milk, and some kind of fish, shellfish, etc. A person can have multiple food allergy. Okay, but food sensitivity. But food allergy, a person may have ideally one or two, not rarely more than two food allergies. Okay, commonly you may be allergic to one or two types of food, not more than that. But you can be sensitive to n number of food products. That is the basic difference between them. Adverse reaction to food. Okay, toxic, non-toxic. Toxic, if you are having a toxic reaction to food, means you are in a stage of food poisoning. Okay, I guess you must have heard about that, food poisoning. Any toxins that you have ingested while having food, that will lead to food poisoning. That is another topic. Here, food sensitivity and allergy is usually caused by non-toxic agents. Okay, so these non-toxic agents can be immune mediated allergy or non-immune mediated allergies. Okay, in non-immune mediated means you have an example of lactose intolerance. Okay, your immunity is not involved here in this non-immune mediated reactions. Your immunity is not involved. Okay, the basic system in your body is not able, your digestive system is not able to break down certain kinds of food. Okay, so that is non-immune mediated. In immune mediated, from the name itself, your immunity is responsible for these reactions. Okay, the antibodies, the T cells, the B cells, they think that the food itself is an invader and it will try to attack it, and while attacking it will cause a series of inflammatory reaction in the body. Okay, so that is immune mediated and non-immune mediated. So this table is there in the book on page number 465. Foods involved in sensitivity, the most common sources, animal sources, always remember, egg whites. Okay, egg whites are a very common source of food sensitizing agents. Okay, and in kids, in infants, while weaning, the children who are in the weaning stage, cow's milk. Okay, that causes a lot of food sensitivity. And lactose intolerant, that will start in the early childhood stage. Some kind of fish, consumption of certain kinds of fish, shellfish, that will lead to food sensitivity. And many adults have food sensitivity to various kinds of meat. Maybe it is red meat or white meat, depends on individual factors. So these are the most common sources of food sensitivity arising from animal sources: egg white, milk, fish, shellfish, certain kinds of meat. Plant sources, usually the plant sources which has gluten, for example, wheat has the high amount of gluten. Okay, rava, semolina. Okay, those things have to be avoided here. And some people may be allergic to peanuts. Okay, kids are allergic to peanuts. And some may be allergic to certain kinds of edible mushrooms. In very rare cases, people are allergic to carrots, spinach, onion, garlic, and all. Okay, so that is the examples of plant sources. Beverages like alcohol. Okay, while preparing different kinds of alcohol, you do require ingredients like, for example, if in beer preparation you require barley malt and yeast. Okay, if somebody is allergic to yeast or barley, in that case they can't have beer. While preparing whiskey, you require wheat as an ingredient for making whiskey. So if you are allergic to gluten or wheat in general, you can't have whiskey. So in that case, beverages do act as food sensitizing agent. In very rare case, coffee and tea will lead to food sensitivity. Usually it is irritant. Okay, consuming high amount of caffeine through beverages like coffee and tea, that will lead to gastric irritability rather than food sensitivity. Reducing the consumption of these beverages will solve that. Okay, fermented food like pickles, achar, vinegar, blue cheese, beer, wine. Okay, because fermentations require certain kind of yeast also is required for fermentation. Molds are formed. Molds means, if you have seen, if you have seen a bread going bad. Okay, green color molds are formed on the white bread. Okay, that's an example of mold. If you're ingesting that, there are high chances that in the future you will get food sensitivity because of mold ingestion, because molds have spores and all. That's the biological reference to their chemical structure. And also food that has gone bad or food that has molds on them should not be consumed. Then you have food contaminants. When you're having processed food, packaged food, it has preservatives, additional colors, flavors, etc. on that. Okay, those will also lead to certain kind of food sensitivity. So these are the examples for this. Symptoms. Skin manifestations. If you see somebody who's having a food allergy, the most common thing you will find is their face, their entire body, their skin will become swollen, red. Okay, some people may have hives. Hives means red bumps will be there, red smooth bumps will be there all over their skin. Dermatitis, itching skin, inflamed skin. Okay, and there will be itchiness and eruptions near the ankles of the lips, angular stomatitis or cheilitis. Okay, so those are the symptoms shown in the skin. In gastrointestinal manifestation, it is very easy to answer that. Bloating will be there, indigestion will be there, constipation. In some cases, there is blood lost in the lost through feces. Okay, so you will find blood in the stool. Cramping, frequent stomach pain, abdominal pain, dyspepsia. Dyspepsia means indigestion. Okay, nausea, vomiting. So these are the gastrointestinal manifestation. Respiratory symptoms, especially in case of anaphylactic shock, when a person is suffering from a severe allergic reaction. In that case, there will be wheezing, closing up of the trachea, wheezing, runny nose, asthma, bronchitis, rhinitis, etc. Neurologic symptoms, for example, pain, muscle pain, joint pain, restlessness. There will be tension fatigue syndrome, too tired to do anything. Neuralgia, damage to nerves, and because of that damage, there will be very severe pain. Okay, so these are the neurologic symptoms. Systemic symptom, anaphylaxis, that is anaphylactic shock. The patient may faint because of that allergic reaction, because may collapse because of closing up of the windpipe, etc. Extreme headache, migraines, cardiac arrhythmia, okay, and hypotension. Their BP will fall very low. That is a systemic symptoms. Diagnosis, how to know that somebody is having a food sensitivity or a reaction to that. The first thing is dietary history. If the patient had immediate response, soon after having a food, immediately the patient had a response, it is much easier to identify what caused this reaction. But if a patient is having a very delayed response, okay, or after 72 to 48 hours after consuming of certain kind of food, there is a response, it is nearly difficult to find out the exact causative agent for that allergy. So in that case, the best thing is to give patient a food diary. In that, the patient is supposed to record everything that they are eating throughout a day, from morning to night. Whatever they have ate, drank, it has to be put in the food diary, and over a period of time it will be checked. And if the same symptoms come up again in the future, it is easier to track what had caused this food allergy. Then you have provocative test. In provocative test, from the name itself, you can understand the thing which is causing the allergy. Purposefully, it is put in the patient's diet. Okay, the patient will not be suspecting it. Unsuspecting food will be put into the diet. The patient will have it, and again, if the patient is going into the same allergic reaction, it will be noted down. For 3 consecutive time, you have to do the same test. The same allergen has to be given in the food 3 different times, and if the patient is having the same reaction every 3 times, means you can confirm the patient is allergic to that particular food. But one main thing you have to remember here is the patient who have severe allergic reaction, the patient had a history of anaphylactic shock because of this food. In that patients, this provocative test cannot be done. Then you have elimination diet. What happens is that the food which is suspected to cause a food reaction or allergy, slowly and gradually that food and its sources is completely removed from the patient's diet. So that is the elimination technique. And usually when you want to eliminate a particular kind of food, it always starts with eliminating eggs, milk products, and wheat from the diet, and then you will see how the patient is recovering from the health scare. If the patient has recovered from the health scare after eliminating these 3 items, that is eggs, eggs, milk products, and wheat. So it can be understood that the patient was having a food sensitivity because of any of these three agents. And further allergy test can be done to confirm which particular agent. So elimination diet always starts with removing eggs, milk, and wheat from the diet. And if at all, if still the patient is not showing recovery, again few more other things from his or her normal diet, it will be gradually removed to finally understand what was the agent causing this reaction. Then you have different laboratory tests for checking the food sensitivity. Skin test, in that there are different skin tests which is done, like patch test, scratch test, intradermal test, etc. In intradermal test, you inject different types of allergen on the patient's into the patient's dermis layer of the skin, and you wait for the reaction to happen. In scratch test, a particular scratch is given, and on the scratch of the skin, the suspected allergen solution is applied, and you will see the reaction. You will wait for the reaction. And in a patch test, what is the suspected allergen, that will be stuck on the skin for 24 hours. After 24 hours, you will check how the skin is responding to that allergen. Usually, if you have an allergy to these allergens, what happens is there is a red wheal formation, there is a red inflammation found where the allergen was placed. So with that, you can confirm that the particular patient is hypersensitive to that particular food. And you have different tests like radio allergen absorbent test. It is a very costly test, and usually doesn't give great information, confirmatory information on food sensitivity. You have X-ray that can be done when the patient is having an immediate response. Immediately you give the patient barium sulfate to ingest, and after that the X-ray will be taken. In the X-ray, wherever the barium sulfate has gone in the GI tract, it will be visible in the X-ray. So any abnormal contractions or spasm in the GI tract, that will be recorded in the X-ray screen. So with that, we can conclude that the patient is having a food sensitivity reaction. So the X-ray is a very easy procedure for that, provided only if the patient had an immediate reaction. In delayed reaction, X-ray is not helpful. Then you have basophil histamine release assay. That's a blood test. In that, your blood white cells has a component. White cells there are different types of white cells. So basophil, eosinophil, etc. are related to allergy. So if you are having a blood test done and there is a high secretion of basophil and eosinophil, it means you have an allergic reaction. You are undergoing an allergic reaction. So that's about the different types of laboratory test. So in children, usually, especially in case of infants, if they're having a food sensitive reaction, the first thing is they will vomit up. They will not feel like having anything. They will vomit. They will be very agitated and restless. They will have continuous diarrhea for 2 days and all. And in the vomiting, there will be mucus. In the diarrhea, there will be mucus. If you see these symptoms in infants, it can be understood that the child may be having a food sensitivity reaction. Food sensitivity is very common among children because their digestive system, the mucosa in the digestive system is immature. It is relatively immature as compared to adults. So it is very difficult for kids to digest certain food. That is the reason why when you are allergic to certain food in the childhood, when that child becomes an adult, usually in most of the cases, they outgrow their allergies. When they are adult, they are no more allergic, or they are no more sensitive to that particular food which they were sensitive to in their childhood, because then the gastric mucosa, the GI system is much more well developed. Then we have the treatment. What can be done to treat these cases? First is the elimination diet, as told earlier. Slowly and gradually remove the diet which you suspect is causing the allergic reaction or sensitivity. So there are two techniques in that: simple exclusion diet and multi exclusion diet. In simple exclusion, only one kind of food will be excluded from the diet. Usually it will be milk, egg, or wheat. That they are the most common agents causing sensitivity reaction in kids and adults. So it is always told, it is always advised to the patients to have diet which is free from milk, dairy free products, free from gluten and wheat, and they should not consume egg. So that advice is given. They can consume remaining all the variety of food. And then there is multi exclusion diet. In that they don't know exactly what is the food that is causing this sensitivity. So slowly, gradually, over a period of time, either they will be given all forms of diet, and day by day they will exclude one item from their diet. And then you have graduated exclusion diet, in which a number of food is excluded at start itself, and slowly these foods are introduced day after day or week after week, to see after introduction of which kind of food the patient is showing allergic reaction. So multi exclusion diet is very difficult to follow in home. It is always advised to follow a multi exclusion diet in a hospital settings, because hospitals have much more control over what the patient is having. It is a much more controlled environment. At home, multi exclusion diets cannot be followed up because of various factors. Okay, the patient sometimes may give into or may fall into having the food which is not supposed to be had from his side. Okay, so that is why multi exclusion diet should be kept for the hospital setting or healthcare setting, whereas single exclusion diet, after taking the advice from the dietitian, the people can follow the single exclusion at their home settings. They just don't have to buy milk products, wheat or eggs, or whatever is the specific kind of diet which the physician has recommended. Only one thing has to be eliminated. That is much more easier to follow at home. Okay. Then you have denaturation of protein. So sometimes it is very common, especially in kids and even in some adults. If you have raw milk with unpasteurized milk or raw milk or cold milk, you may go into the state of lactose intolerance. You may suffer from diarrhea or any other abdominal issues. But when you are having hot milk, when you are having milk that is adequately processed, or in form of tea or coffee, in that type, you are able to tolerate the milk in a much more easier manner. Okay, so what is happening here is a denaturation of protein. Denaturation of protein means, that we have discussed earlier, protein is essentially a branch of different types of amino acids coming together. Okay, when you're cooking, okay, it is always said that do not heat milk over and over again. Okay, because that will the protein quality will fade off in the milk. Okay, too much of pasteurization and too much of boiling the milk over and over again, okay, that will lead to the denaturation of protein, means most of the protein content will be lost. Okay, so overcooking paneer or overcooking any food which is rich in protein, that will lead to decreased quality of protein. Okay, so automatically when the protein quality is decreased, some people are able to tolerate it more easily. Okay, so that method can be followed. If you are not able to have raw milk, but milk is essential for a child's growth, to maintain a proper growth and development, milk is essential. Okay, in that case, parents can be advised that to avoid products which has raw milk, avoid giving raw milk to the child. Always give protein like milkshakes, or cook the milk properly and then give them. Okay, so that kind of techniques can be used in this kind of treatment. Hypertensitization, slowly, very small doses of allergens, the things which are causing allergy, in very small doses, the physician will inject these allergens in the body, in a hope that over a period of time, the body will respond to these allergens in a normal way. It will not try to attack these allergens. It will respond to the allergens in a normal way, and slowly that food can be consumed. Okay, so it is a very trial and error based treatment. Usually in homeopathy and all, they follow this theory. A very small amount of allergens or causative agent is given in this kind of treatment, so that over the period of time the body learns how to tackle it without giving an adverse reaction. So that is hypersensitization. Then you have drugs, antihistamines and all. Okay, antihistamines, so there are a number of drugs that will relieve an allergic reaction. So that is based on prescription. Okay, and usually the most common drug is cetirizine, which you must be heard of. Like when you have cold, cough and cold, you can have cetirizine. But the side effect, the common side effect about these allergic antihistaminic drugs are they are somnolence. They give excessive sleep. They make you drowsy, and they induce a lot of sleep. So that is one side effect that you have to be careful of. So these drugs cannot be taken on a daily basis because of this neurological effect. Then you have dietary advice. Always follow the dietary advice of your consulting physician and dietitian when you are sensitive to certain kinds of food that has things which has to be completely eliminated. It has to be eliminated slowly. After 6 months period of time, these things can be introduced in small quantities to check if the body has overcome the phase of hypersensitivity or not. Okay, if the patient is still sensitive after 6 months, it is concluded that the patient is sensitive, and for their entire life they have to eliminate certain food. Food intolerance. So food intolerance and allergy, the key difference is in allergy your immune system is involved. Okay, allergy means an aggregate altered immunity response to certain invaders. Okay, so that is a food allergy. But food intolerance means your body is not able to break down food properly. Okay, so that leads to intolerance. So symptoms of food intolerance is bloating, diarrhea, nausea, indigestion, eczema, asthma, etc. For food allergy, it will be usually hives, that is red bumps on the skin, itchy bumps. Okay, itching, swelling, vomiting, diarrhea, and nausea. And food intolerance occurs when you are unable to properly break down a certain food because your body may lack certain enzymes. Okay, you all know that body requires certain enzymes to break down certain amino acids and certain compounds, complex compounds. If it has to be broken down, you require enzyme. If your body is not producing enzyme, you are not able to break down that particular compound, and you go in a state of intolerance. So intolerance is not life threatening. Symptomatic management can be done. Food allergy, in case of anaphylactic shock, it is potentially life-threatening. There are other similarities between intolerance and allergies. These are, there is no specific cure for that. The only thing is you have to eliminate those kind of food. But usually when the child grows older, these intolerance and allergies are resolved over a period of time. Sometimes it is not resolved. Why the body makes no particular enzyme, or why the body is attacking this particular invader which is supposed to be good for the body but it is attacking it, there is no reason to it. That is still idiopathic, unknown. Okay, basically the food that can trigger intolerances can also be the food that can cause allergies. In earlier childhood, if a child was having intolerance towards certain kind of food, if that intolerance was not over, if the child was not able to outgrow that intolerance, chances are that this food intolerance will turn into food allergy in later life. Example, in case of eggs, shellfish, nuts, dairy, wheat, gluten, fish, and soy. Then we have fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. In short, it is called FODMAP. So please underline that. From exam point of view, it is important. You can take a screenshot of this, so it is easier to understand. So F stands for fermentable. Oligosaccharides, disaccharides, monosaccharides. These are the different types of compounds for carbohydrates. And polyols. Polyols are natural as well as artificial sweeteners. And oligosaccharides, the carbohydrates that are short chain carbohydrates. disaccharides, two complex carbohydrates are attached. Monosaccharides are single chain, that like glucose and all. Okay, so these different types of complex carbohydrates as well as simple carbohydrates. Okay, these if these are not digested in the body, if it is not properly digested in the intestine, they are deposited in the large intestine, the last the lower part of the large intestine, and there they will undergo fermentation. And when these oligosaccharides, disaccharides, and monosaccharides, and some kinds of polyols, when they're undergoing fermentation inside your body, inside the large intestine, they accumulate a lot of water. They will release a lot of carbon dioxide, methane gas within the intestine. And because of this reason, the intestine will stretch and expand. Okay. And that is what you see it as bloating. Okay. Bloating, stomach distension, abdominal distension, etc. Okay, so this is what happens if the body is not able to digest oligosaccharides, disaccharides, monosaccharides, polyols. Okay, it will be in the undigested form. It will accumulate in the large intestine, the lower part of the large intestine, and when it is accumulated in the large intestine, it will undergo a lot of fermentation. When this fermentation process is going on, a large amount of water will be attracted, it will be drawn to this large intestine area where this is undergoing fermentation. Carbon dioxide gas is released within the intestine, methane gas is released within the intestine. And because there is a lot of water and gases in the intestine has a certain capacity, it will automatically try to accommodate more, it will expand and it will stretch. And that is what you see outside as a distended abdomen, bloating. Okay, so that is why bloating takes place. So these are the things which you have to avoid. For example, oligosaccharides, the things which contain oligosaccharides are wheat, barley, legumes, garlic, onion, cauliflower. Okay, these have oligosaccharides. Disaccharides are seen in all the dairy products. Okay, milk, yogurt, soft cheese, they have disaccharides. Monosaccharides are seen in fruits like apple, mangoes, figs, honey. Okay, they have monosaccharides. And polyols means your artificial sweeteners, some natural as well as artificial sweeteners like stevia, some berries. Okay, sorbitol, mannitol, etc. Low calorie sweeteners. These are the examples of polyols. These all are carbohydrates, different types of carbohydrates. So to prevent bloating and abdominal distension because of this, these things have to be avoided. Okay, so the FODMAP is the list of items that should be avoided. So when you avoid that, you have to follow this diet. Okay, low FODMAP diet, things which are naturally low in oligosaccharides, disaccharides, monosaccharides, and polyols. Okay, these are the vegetables, fruits, dairy, proteins, grains, sweeteners, and nuts, which are naturally low in oligosaccharides, disaccharides, monosaccharides, and polyols. So your body will not undergo unnecessary fermentation of these complex, simple carbohydrates. So you can take a screenshot of this. So the patients who have to be under low FODMAP diet because they are having a lot of distension issues and lot of bloating issues, they can have this low FODMAP diet to prevent unnecessary bloating of the intestine, etc. It's not that for a lifetime you have to restrict those the foods which has to be restricted in FODMAP. Okay, slowly you can reintroduce the foods which are high in oligosaccharides, disaccharides, and monosaccharides. It can be slowly reintroduced, but if it still causes the same symptoms, then you can avoid it for a lifetime. So that's about food sensitivity. If you have any doubt, please mention in the chat box. MSG, I guess it is Ajinomoto. I'm not sure about that. It may be Ajinomoto. It is very notorious to be known used in Chinese dishes and restaurant, and which is harmful to health. I'm thinking it may be MSG, might be that, but I'm not sure about that. You can Google that. And there is no specific reason to avoid egg, wheat, and milk unless and until you are sensitive to it or allergic to it, because egg, wheat, and milk are the most common. Yeah, okay, yes, it is Ajinomoto, monosodium glutamate. Okay, yeah. So MSG is Ajinomoto. Okay, yeah. So about the egg, wheat, and milk, if you are sensitive to it, if you are allergic to it, you can avoid it. Otherwise, there is no specific reason to avoid it. But these are the things which most of the population is allergic to or sensitive to. That is why it in every food sensitivity test and everything, these are the items first removed from the diet, and then they will follow up for later. Table 21.2 is to understand, like, just read through that exclusion diet. Okay, and if you want to understand what to be excluded, how to be excluded, and when to be excluded, okay, over a period of this 2 months, how you can do the exclusion diet, okay, that you can understand using the table 21.2. That's for practical purpose, it's only. Okay, and it's something that, for example, elemental diet and everything is something that you cannot do at home. It is exclusive for the hospital settings only. Immunoglobulin, IgE, means immunoglobulin, the antibodies which have been formed against specific antigens. Okay. You can undergo the same elimination diet for FODMAP. In the first week, you have to eliminate the oligosaccharides. Second week, eliminate the disaccharides. Third week, eliminate the monosaccharides, and see how the patient is responding to these eliminations. Accordingly, you can understand which is the particular food group which is causing bloating. Is the screen visible to all in slideshow format? Okay, so the next topic is inborn errors of metabolism, the next chapter after food sensitivity, page 474. So it's a hereditary disease. Okay, it is genetic. Usually, most of the errors of metabolism are genetic. Okay, these are inherited disorders which the body cannot properly turn the food into energy. Whatever food you have, it has to be converted into kilocalories. Okay, KCL means it has to be converted into energy. So at the birth itself, the kids, certain newborns are not able to metabolize certain complex food. Okay, so that is because of certain inborn errors of metabolism. So these disorders are usually caused by defects in a specific protein or enzyme that help the breakdown of parts of food. We have studied that in previous classes, that protein will help in the formation of different enzymes. These enzymes are required. There are enzymes in your gastric juice, enzymes in your small intestine, enzymes secreted by the pancreas, livers, etc. Okay, why these enzymes are secreted? To break down the complex food which you are having, to break down the complex food into simpler compounds which can be stored in the body or utilized by the body. Okay, so when there is a lack of enzymes or absence of this a particular enzyme, it will lead to a specific error in metabolism. Okay, so there is a classification table in page number 475, table 22.1. In that you can just read through it. Okay, different types of input errors of metabolism, as well as which nutrient is involved for that particular cause. Okay, so you can, the most common thing which we are studying here is the phenylketonuria, and there are different types of input because of protein metabolism, organic acid metabolism, fatty acid metabolism, basically lipid metabolism, and these are because of carbohydrate metabolism. Any error in these different metabolisms, it will lead to these different diseases. So coming to phenylketonuria, it's a pretty long topic from page 474 to 478. Whatever is there in in these pages, I have put in the important points. I have put it in the slide. If you are thorough with what I'm presenting here, you will be mostly clear about what phenylketonuria is. Okay, so in short, we call it as PKU disorder, and so it is a genetic disorder in which there is a buildup of phenylalanine. Underline that, it's on page number 474. The first two lines itself, you will find that. Underline that, because this is the main thing which you have to remember in this disorder. Phenylalanine. Okay. So phenylalanine is essential amino acid. It is an essential amino acid. It forms up as a compound of protein. Okay. It is contained in a lot of different food. Okay. For example, fish, pork, cheese, breast milk, etc. That is, these are the food which is high in phenylalanine. Other than that, this can be found in n number of different food also. Okay. So this is the thing which you have to understand, why phenylketonuria happens. Okay, so phenylalanine, which is present in amino, it is an essential amino acid. You eat it through various different forms of food. Okay, amino acid will get broken down. Now the amino acid have released phenylalanine from its structure. Okay, so this phenylalanine has to undergo a conversion to a product called tyrosine, and it can undergo this conversion only if PAH is available. And what is PAH? It is phenylalanine hydroxylase. Okay, from the name itself, we can understand hydroxylase means it will break down the phenylalanine compound to get tyrosine. Tyrosine is used for various different function in the body, like melanin, for the secretion of melanin. Melanin is a compound which will give color to your skin. It will keep your hairs black, or whatever the color of the hair is. Okay, it will keep the hairs dark. It will give the color, a specific color to your skin, melanin. Tyrosine is important for various protein synthesis. Okay, for the muscle building, etc. It is also important to give energy through protein. Okay, if carbohydrates is deficient, convert the protein into energy. For that also tyrosine is required. But if this enzyme, pH enzyme, is not produced by the liver, okay, liver produces it. If it is not produced by the liver in enough quantity, or a liver is stopping the production of PAH, what happens is phenylalanine will not be converted into tyrosine, and it will be in this form itself in the body, and it will be building up in the body tissues itself in the form of phenylalanine, and thus it will lead to phenylketonuria. Okay, it will be in the blood. It will go into the kidney, and from the kidney it will be excreted in excess amount through the urine. Okay, because instead of getting converted into tyrosine, that is not happening. So it has to escape somewhere or anywhere, and that is how we get this disorder. Okay, so these are the symptoms. In this particular slide, the symptoms, prognosis, treatment, everything will be covered. So at the end of this slide, you can take a screenshot of that. So symptoms are the child who has phenylketonuria. Okay, they have a very small head. Okay, it is called as microcephaly. You will find a term in the textbook called microcephaly. It means small head size than normal. Okay, musty odor in the child's breath, foul odor, unclean and stale odor, stale smell from the child's breath, skin and urine. The child will be mentally retarded. Okay, there will be behavioral as well as social problems and development problems in the child. Seizures, epilepsy, fits will be seen in the child. Okay, these are the very common symptoms of phenylketonuria. And occurrence, the rate of occurrence is 1 in 10,000 people. And usually the race of Caucasians and Orientals are the only, Orientals means East Asians. Okay, they are the ones who have high chance of getting this disease. It is very rare in India and other South Asian countries. It is very rare, and even in Middle East and Arab countries, it is very rare. Usually, it's found in Western countries as well as in East Asian countries. Prognosis, if the treatment is not given at the correct time, that is when the if during the first 3 weeks of age, as soon as the child is born, urine analysis is done, and within the 3 weeks of age, that is within 1 month, if the treatment has not started, then it can lead to intellectual disability. Okay, that usually these children will have an IQ of less than 100. Okay, so this PKU can lead to intellectual disability at the end of first year of life itself. Within the first life 1 year itself, the child may go into the stage of mental retardation, and this can cause irreversible mental retardation if treatment is not given in the right time. Sometimes it can also lead to ADHD, that is attention deficit hyperactivity disorder. Okay, these kids are very restless and they can't pay attention to a particular topic even for 1 minute. Okay, so they are very hyperactive and their mind will go from one topic to another very soon. They can't focus. That is the main thing here. These children cannot focus on any of the task which is assigned to them, not just in studies, in day-to-day life also. So treatment, a newborn should take the PKU test. Okay, usually it is the urine analysis, and if the test is positive, that is if the phenylalanine concentration in the urine is more than 2 mg per deciliter and all, so in that case you have to check it to confirm that it is in high amount, and if the test is confirmed, you have to start the treatment. Okay, usually the parents of the newborns are instructed to start a lifelong treatment for this particular child. Okay, and if they are having a restrictive diet, for example, having food which is completely deficient of phenylalanine, in that case the child can live a very long symptom free life. Okay, it not necessarily all the children who have PKU will go into the stage of mental retardation. They can have a long life, symptom free life, if a proper diet restriction has been followed. Okay, so you can take a screenshot of this. These all are pediatric disorders which has to be exclusively treated by a pediatrician. Okay, or a dietitian or a nutritionist can tag along, but the main head of the team should be a pediatrician in these cases. The others cannot prescribe this treatment whatsoever in whatsoever means, because these are kind of life-threatening conditions for a child. So in that case, people with a medical background are only allowed to cater for these diseases. In the first few weeks, only the child will show symptoms. Okay, irritability, alkalosis, acidosis will be there in the child with blood test and urine test. Usually they try to eradicate the chances of PKU. Generally, these tests are done within the first 3 weeks. In India, it is not much common, but in other Western countries and East Asian countries, as soon as the child is born, within 3 weeks, at the end of second week or third week, urine analysis and blood analysis is done to rule out any cases of PKU. So next topic is galactosemia. So take a screenshot of this particular picture. If this is clear, this picture is clear for you, it is much easier to understand this. So galactose is a compound it is a carbohydrate which is found in milk. Okay. Galactose will be converted into glucose. Okay, for energy. And if galactose is not able to be converted into glucose in absence of certain enzymes that will convert galactose into glucose, okay, in that case the rate of galactose will increase in the blood. Okay, galactosemia means in blood the amount of galactose have exceeded the normal value. So in that case, in severe cases, it will lead to kidney failure, enlarged liver, cataracts, brain damage, etc. There are not just one enzyme, there are many different enzymes involved to convert galactose into glucose. Okay, galactokinase, galactose 1-phosphate, uridyl transferase. Okay, examples, these are the examples of that. So it's there in the textbook, but you don't have to get too technical about that. Just understand this. Galactose is found in milk. It has to be converted into glucose for energy. Your body requires energy, your cells require energy. But if the body is not able to convert galactose into glucose, it will lead to galactosemia. Galactosemia is nothing but increased concentration of galactose in the blood, and it will lead to, in toxic levels, it will lead to kidney failure, enlarged liver, cataracts, brain damage, etc. So a child who is having galactosemia, they will usually have swelling of their brain. Okay, the swelling means, the medical terminology is edema. Wherever in the textbook you see edema, please understand that is swelling for people from non-medical background. So when there is swelling in the brain, swelling around the brain, obviously there will be increased cerebrospinal fluid, CSF fluid will be increased, and that will cause pressure around the brain. And the child will not have appetite. There will be kidney issues, spitting up or vomiting, liver failure, jaundice, okay, and sepsis. In extreme cases, the child may go into the state of sepsis. In sepsis, what happens is n number of bacteria and virus can cause infection. Usually when infection happens, it is causative agent may be either 1 or 2 maximum. But in sepsis, n number of bacteria and viruses can cause infection. Okay. So how is it treated? The only way to treat galactosemia is through dietary restriction from the first days of life. No breastfeeding. Okay, no breastfeeding, because it's breast milk. Milk has galactose, and these galactose cannot be converted into glucose. So completely avoid milk products for this child. Soya-based formula can be given. Okay, the newborn with questionable results on screening should continue to be treated with soy-based formula, and whatever is the pending nutritional supplements required by the child, it can be given in the form of different nutritional formulas. Okay, but at no cost the child should be given any milk or milk products, not even breast milk. Next condition is there's a galactose restricted diet. A table is given on page 479. You can follow that for your consultations, etc. Just read through that. The same thing, all the food that has milk has to be avoided. Even cheese or yogurt or curd, nothing can be given. Butter cannot be used. Oils can be used, but butter cannot be used for these kids. Next condition is fructose urea. I hope those who have attended the carbohydrate class, they remember certain terms from carbohydrates like lactose, fructose, galactose, sucrose, etc. Okay, so these are like simple and complex carbohydrates. So at the end, all these kind of fructose, galactose, sucrose, these everything has to be converted into glucose, or in case of fructose and all, they can essentially be absorbed in their full form itself by the intestine. Okay, in other cases, all these has to be converted into glucose so that the body can absorb and use it for different purposes. So in fructosuria, it's an inborn error of the fructose metabolism caused by the deficiency of fructokinase in the liver. Again, an enzyme. Fructokinase is an enzyme. Deficiency of fructokinase means what happens? Fructose will not be converted into glucose. Okay, so fructose is not converted to glucose. Its level is increased in the blood. That is fructosemia. Galactosemia, galactose is increased in the blood. Fructosemia, fructose level is increased in the blood, and it will be excreted by the in large amount by urine, because blood undergoes filtration and everything in kidney. Anything that is too much in blood will be excreted by the urine. So because the kidney is trying to bring the pH balance and the electrolyte balance in the body. Okay, so usually it is a harmless condition. It's a very rare condition also, and usually it is a harmless condition. And how you can do the management for this is, fruits has to be avoided for these cases. Okay, because fruit has a high quantity of fructose. Okay, the sweetness present in fruits is because of fructose. So fruits has to be completely avoided for this diet. It is very easy for a growing up child, but when they turn to adults, it must be quite difficult. But for that, and vitamin C supplements should be given from additionally, because fruits are a very rich source of ascorbic acid and vitamin C, etc. So if you are completely avoiding fruits from your diet, what you are missing out from that fruit has to be taken in form of nutritional supplements. So in that case, vitamin C supplements can be given, and that has to be maintained for a lifelong, as a lifelong practice. Then you have another small condition called as fructose 1,6 biphosphatase deficiency. Okay, don't get confused by the name. Just understand that fructose is coming from fruits. Okay, as told earlier, fructose is coming from fruits, and in presence of different enzymes like fructose 1,6 biphosphatase or phosphofructose kinase 1, etc. Here, if you want to convert fructose and store it in the liver, okay, if you want to convert fructose and store it in the liver, you require this enzyme which is in the green circle. Okay, can you see the green circle? That is phosphofructokinase. You require phosphofructokinase to convert the fructose which you got from fruits and store it in the liver in form of fructose 1,6 biphosphate. If this is present, okay, this conversion is easy. Okay, it will be stored like this. But if this second enzyme, which is shown in the red circle, fructose 1,6 biphosphatase, okay, if this is deficient, the fructose which is stored in your body, in the liver especially, cannot be converted into fructose to give energy. Okay, so that is the deficiency. And the main thing is, your body goes through different stages of deficiency throughout a day. Okay, there are times like during early morning, your body is deficient in carbohydrate. Your blood glucose level is very less early morning. By midday, it is quite high. Okay, so it's a that's a cycle which happens every day. But to overcome these small deficiencies on day-to-day basis, your liver has enough stores of fructose, glucose, and everything to add up for any deficiency. But if the liver doesn't have enzymes, even if it has enough stores, that is not going to help. Okay, so in that case, what you have to do, instead of giving a child food which is rich in fructose, because already you know that the fructose cannot be brought back from the liver, do not give food which is rich in fructose. The same thing you have to follow here. Avoid fruits in this diet. So it is an inherited metabolic disorder in which body cannot properly make glucose by the stored up fructose. So it can be treated by complete avoidance of fructose. For example, completely avoid fruits in your diet, okay, and its related sugar, and as well as by avoiding prolonged periods of fasting. Do not go into long fasting. Have short frequent meals. Those who have this deficiency, it is very rare, but even if you come across a person who may have this deficiency, long periods of fasting like 12 hours fasting, 10 hours fasting should be avoided. Then copper deficiency causes this Menkes disease. Okay, copper deficiency is very rare. Usually, all the food which you have has trace amounts of copper in it. But the problem will come when the body is not able to absorb the copper which you are feeding it. Okay, so because of that, malabsorption or dietary deficiency or anything like that, because of that, copper is not reaching the brain, skin, hair, and bones. Okay, because of low copper concentrations, we will see various kind of symptoms, like usually it is seen in kids. Clinical features like sparse and kinky hair. There is an image of a child suffering from Menkes disease given in the textbook. Those who have textbook, please see that. Okay, in that you can understand how in real life this child may appear. Okay, lots of developmental milestones. Developmental milestones means the first time when the child, a newborn baby turns on its own back, starts to crawl, okay, starts to walk. Okay, these all are developmental milestones. Starts to speak for the first time, first words, tries to form first full sentences. Okay, identifies the mother, identifies the father. Okay, so these all are developmental milestones. So the child who is having low copper, child who's having copper deficiency, they may have these clinical features, and they in a high in a hereditary disease case, they have this disease called Menkes disease. So truncal hypotonia means their muscle mass, there is no tone in the muscle. Okay, their muscle has very low tone, there is no muscle tone. That is truncal hypotonia. Failure to thrive means proper adequate growth and development, along with that proper weight gaining according to their age is not maintained. Epilepsy, fits, convulsions. So how you understand that a child may be having Menkes disease? Through low serum copper levels, low serum ceruloplasmin levels in the blood analysis, laboratory result, you will understand that. And treatment is copper chloride tablets are given, and L-histidine injections are given. So this is a medical area, so that will be taken care by the pediatrician. So, but identifying a child with these features, you have to understand these clinical features. This Menkes disease is caused by absolutely low copper levels in the body. Then at last we have Wilson's disease. This is just the opposite of Menkes disease. In this you have high concentrations of copper. Okay, and how does this happen is when you are cooking food in copper vessels. Okay, storing food in copper vessels, and consuming food that are rich in copper as a mineral. Okay, in that cases your body can go into a toxicity level, have a toxicity level of copper. Okay, and when it is hereditary, it is called Wilson's disease. And these are the clinical features of Wilson's disease. Okay, in the cornea of the eyes, the surrounding the cornea, you have green and sometimes brown, sometimes green ring, and that is called Kaiser-Fleischer's ring. You can Google this image here, or you can Google this word here, Kaiser-Fleischer's ring. You can see how it looks in real life. Okay, it will lead to cardiac complications, renal complications, because the kidney has the overwork to remove excess copper into the urine. Jaundice, hepatitis, hepatic failure, okay, liver cirrhosis will be the complication happening to the liver. Rickets may take place in children. hemolysis, all the red blood cells will be broken down because of excessive copper in the blood. And central nervous system, behavioral changes, deterioration in school performance, intentional tremors, their hands and feet will be like it will be shaking all the times, like they are shivering. Okay, dystonia means their muscle will not have enough mass, and it will not muscles will not have a tone. Okay, excessive salivation, mask like faces, and dysphagia means difficulty in swallowing. Okay, when they are having food, they feel pain or they find some difficulty in swallowing.